So when the operating room is ready, your anesthesiologist or nurse anesthetist will meet you in the preoperative area and roll you back on your stretcher into the operating room. Once you're there, you're going to move yourself onto the operating room table, and you're going to be in the seated position. You're going to have a pillow that you're going to be hugging. So you're going to have what we call a mad cat posture, and this is for the spinal anesthetic. You're going to have your chin tucked and your back rounded, and the nurse in the operating room will help you get positioned. You'll feel us clean off your lower back and put a sticky drape over everything to keep everything clean. And then again, you'll feel a little pinch on your low back, and that's the numbing medicine in preparation for the spinal anesthetic. At that point, you'll feel a little pressure, and the medication is injected into your area where your spinal fluid is. And nothing stays in. Everything comes back out. Once that's finished, we'll lay you back down on the stretcher. We'll give you some oxygen to breathe through a plastic mask, and we'll start a medication called propofol through your intravenous line. You may feel or see some activity as the surgery staff get you into position, but within a minute or so, you drift off to sleep. And that your anesthesiologist or nurse anesthetist stays with you the entire time, making sure that you're sleeping comfortably and wake you up when the procedure's all done. Once you're finished, you may remember rolling back into the recovery room. Once you're in the recovery room, you'll meet your post-operative nurse who is going to assess your spinal. It's very normal to have complete numbness when you're in the operating room of your legs. Usually within about 90 minutes or less, that spinal is going to wear off. Your post-operative care nurse is going to make sure that your pain is well controlled, that you don't have any nausea, and that you can empty your bladder. Once all those boxes are checked, you're going to meet your physical therapist who's going to get you up and walk you around our facility and use your new joint before you go home.